Hi, everyone. My name is Katherine Janzen. I'm a student occupational therapist doing a placement here at SARI. This presentation on fluctuating tone is approximately 24 minutes. Thank you. In this webinar, we're going to be looking at what is tone. We'll look at the spectrum of muscle tone from high tone to low tone. What can we do to help our participants? How to implement some strategies and also some references for future study. So what is tone? Muscle tone is the amount of tension, or rather the resistance to movement in muscles. This little picture here shows a really good description, which illustrates the difference between muscle tone and muscle strength. So when we think about strength, it's really the muscle's ability to contract and create force in response to resistance. And muscle tone, on the other hand, is actually when the muscle's at rest. Muscle tone is regulated by signals that travel from the brain to the nerves and tell the muscle to contract. Differences in tone happen when regions of the brain or spinal cord that control these signals are damaged. So different regions of the brain and spinal cord result in different presentations. And in this image, what you'll see are images of the brain that produces different presentations of cerebral palsy. So why does this all matter? Well, it turns out that over 85% of participants at SARI live with conditions affecting tone. The conditions might include autism spectrum disorder, Down syndrome, muscular dystrophy, cerebral palsy, and so on. This is not an exhaustive list. The important thing to remember here is that tone changes, as in tone fluctuates. So someone who comes into SARI at the beginning of a session may present with very high tone, and by the end of the session may have less high tone. Similarly, someone with low tone is not going to leave necessarily with high tone or increased muscle strength, but just to recognize that these things are changeable, they're not static. And it's best to think of muscle tone in more of a spectrum than either just hypotonicity being low tone or hypertonicity being high tone. In fact, almost everybody on the planet would fall into this spectrum. And even athletes who are training for Olympic level sports may not necessarily fall into normal low or normal high or right in the middle. They may be somewhere on either side of this. Muscle tone has three important functions. It assists in maintaining good posture, it can store energy to release it at a later time, and it also allows for more fluid-like movements. Why should we care? Because all of these functions are needed when we're doing therapeutic riding with our participants. So on one end of the spectrum, we have high tone, and we're not talking about music, baby. High tone is also referred to as hypertonicity, and it's a condition where there's too much muscle tone. Muscles are often stiff and difficult to move. They appear tight. Spasticity, on the other hand, is a type of hypertonia in which the muscle spasms are increased by movement. So for example, if you have someone who comes in and they are experiencing very high flexion in the knees, and then when they go to straighten the leg, there's that extra resistance there, a kickback. That would be spasticity. In this type, patients usually have exaggerated reflex responses. What does this look like at SARI, for example? So very, very plainly, hypertonicity, if you'd like to remember, is more tight muscles. So these are some of the things that I've seen and that instructors have reported to me with respect to participants coming in with high tone. So you might see tight hip adductor muscles. So a participant has a really difficult time opening their legs in order to mount the horse. So a narrow opening for the barrel of the horse. You may also see tight hip joints, which allow for very little external rotation for mounting, which may limit your ability to mount in different positions. You may be limited to croup or crest. Often when someone has high tone, we really start them off with a crest mount to begin with. Also, as I mentioned previously, you may have tight knees. So the knee is in greater than 90-degree flexion. Ankle and foot can be locked in extension or flexion, which may interfere with putting them inside stirrups. And also, participants may have difficulty with arm high tone in their arms. So reaching one arm into extension to hold reins may be difficult. And as I mentioned previously, we may also see increased spasticity with movement. So on the other end of that spectrum, and remember, there's a whole lot in between, we also have low tone. That's called hypotonicity, and it's characterized by a decrease in muscle tone, particularly in the trunk of the body. So we're lacking some core strength there. So some of the symptoms of hypotonia can include problems with mobility and posture. It can even include problems with breathing and speech, ligament and joint laxity, and poor reflexes. So here are some images that really kind of illustrate what hypotonia can impact. So on the right, you'll see grip strength, speech swallowing, motor skills, posture, breathing, even digestion, mobility, endurance, stability, and potty training. The classic image of a hypotonic baby is the floppy baby shown on the left. So what does this look like at SARI? Hypotonicity really does manifest itself with decreased postural tone. So there's that difficulty in maintaining a posture while seated on or mounted on an equine. So you may see a participant kind of flopping forward or backward, unable to right themselves. That piece, that self-righting, which is a reflex, becomes extremely difficult. And so if there are transitions in movement while the equine is moving, there's that difficulty to get back into a balanced position. There may also be difficulty lifting limbs for mounting and bearing weight through limbs for 2-point. Participants with hypotonicity may also struggle with fine and gross motor activities, including grasping reins or surcingles. So what can we do? I've seen a lot of incredible interventions through the course of my stay so far at SARI. And so I'm going to be going over some of the things that we can do before, during, and after our sessions with participants. For participants with high tone or hypertonia, we want to focus on flexibility, balance, and graded activity. Stretching is very important for these clients. So something we can do right away as soon as the participant is mounted on the equine is have them greet their horse. So bending forward, forward flexion at the hips, leaning towards the mane, saying hello. Likewise, encouraging a participant to lean backward, turning around and twisting towards the tail on either side can all be done at a halt. And then repeat it again as we're in motion. The instructor also can choose a horse. So choosing a narrow horse with smooth gaits can really help tight muscles to encourage to relax, and in turn helps with balance and flexibility. As we already know, the horse's movement makes a huge difference in relaxing muscles and bringing participants' extremities into a more functional position that they can use with intention. Something we have control over as well is the type of activities we choose and how we grade them. So playing games to get a participant to stretch down to their toes or reach up to a pole can help with flexibility. We can also design activities that encourage them to cross the body with their extremities, stretch towards the mane, and more so in hippotherapy, we can actually do graded riding positions. So starting out in a prone position, eventually moving up to a supported seated position, and then an independent seated position. We can also choose maneuvers which help folks with hypertonia. So doing large bends or circles can help with balance and stretching out sides of the body. So for example, if someone has a lot of tightness on their left side, doing circles to the right can actually help them stretch out that side body. We can also do certain maneuvers that encourage the upper extremity use on the tight side. So for example, again, reaching towards a pole, maybe repeating that several times on the tight side until we see a little bit more mobility there. The horse's body gives off heat. Coupled with movement, this helps to reduce unwanted high tone. How can we enhance this? We can have the participants sit on a sheepskin or a saddle pad rather than a saddle. Lastly, one thing that we can also do is experiment with different mounting. So for example, if you have someone with very tight hips and legs, you may need to do a crest mount at the beginning. However, with practice and as this person stretches out some of their muscles, and we reduce some of that unwanted high tone, you may want to talk to the occupational therapist or physiotherapist on staff to see if you could transition to a croup mounting after the body has warmed up. So for example, starting with crest for the mount and moving to croup for a dismount. So for hypertonia or high tone, before and after lesson activities include a focus on warmth, stretching out muscles, and also extensor activation. Some ideas before the lesson would be to advise our participants to get their muscles warm before they arrive. That includes getting physically warm, especially in the winter months, whether that's wearing warm clothing or walking around in advance of the lesson, moving around, getting warm. You can also recommend at-home stretching. So a forward fold for stretching out the backs of the legs, or a frog pose for tight groin and hips. For folks who have really high tone, the frog pose might be better off supported with a pillow, a body pillow underneath, or even just several cushions or a bolster. As mentioned previously, getting muscles warm by activation is a good way to warm up before a lesson. So asking participants to go from sitting to standing, holding that standing position for 3 breaths, and then sitting back down. Also taking a short walk, even just a few steps, taking a break, and then walking again for a few more steps. If participants are able to come early and practice on the barrel, they can warm up their inner thighs and their groins, stretching those out, and even can practice stretching on the barrel. So doing some of those very loved poses, such as the washing machine or the airplane, reaching behind them to the horse's mane, or reaching forward to the horse's mane or backward to the horse's tail. At the mounting block, we can encourage our participants to be really vocal about how they're feeling today, whether they're feeling tight, whether they're feeling pretty loose, whether they're feeling warmed up or not, so we can better accommodate how they are in that moment. Also encouraging our participants to take 3 deep breaths before mounting. Ideally, they can maintain that deep breathing as they get on the horse. After the lesson, we can encourage our participants to do a few things to help cool down their muscles. So for example, participate in untacking and grooming the horse. Maybe take a silly walk, inspired by Monty Python, really shaking our legs out as we walk, swinging them from side to side, doing everything that our body is asking of us. Another option is to sit like a frog, as shown in this image below. And at home, we can do some supported stretching. So a supported or sitting forward fold. Notice that that's a little bit less intense than the warm-up stretch we had recommended. Also, just sitting on a body pillow, ball, or bolster, not necessarily holding that frog position, or taking a wide-legged child's pose, which is very relaxing and restorative. There are many videos online regarding progressive relaxation to help us kind of cool down our muscles and our mind, and of course, taking a warm shower or bath. Yeah, so for folks with low tone or hypotonia, the focus should be on pelvic stability, engaging core muscles, and enhancing motor skills. So starting with warm-up stretches, these can be guided or independent prior to moving around the arena and then repeated in motion. Either way, I think it's important to make use of that time where a participant is perhaps waiting for their partner to mount. Um, Instructors also have a choice around what type of horse would be best suitable for each participant. So for folks with hypotonia, looking at a wider barreled horse with a more percussive, snappy gait does stimulate weaker muscles. Of course, watching for excessive hip abduction, which can be painful and uncomfortable for participants. We also have a choice of tack, so choosing a saddle perhaps with a deep seat that provides more stability, or conversely, a pad and surcingle, which allows more heat to move through. Also choosing whether or not stirrups could be used, which helps with weight bearing through the legs. Positioning is again important. It can be varied and graded. So a participant could be initially required to hold a limb against gravity or hold themselves up in a prone position before moving to an upright position supported by pillows or otherwise. Positioning is probably more important with hippotherapy programs and occupational therapy. Graded activities are important. So playing games using a ball toss of different sizes to kind of work from a larger ball to a smaller ball, perhaps, that requires more fine motor. Also holding a new position and completing a task, or trotting in short bursts or as tolerated, will help engage core muscles while also challenging motor skills. External sensory input has proven to be quite good for folks with hypotonia. So either providing tapping or vibration on muscle bellies can be used to help activate muscles. And of course, skills, those riding skills. So we can help improve a participant's proximal stability by asking them to weight bear through their limbs, that like we do during 2-point. Also, we can work on fine motor by asking participants to hold reins as opposed to the saddle, and also encourage gross motor skills by having participants lift their limbs in order to help us mount. We can also use visual stimulation for participants with hypotonia. So asking them to perform tasks using mirrors so that they can have some visual feedback on how their posture is and how good postures feel. So getting to know what a good posture looks like and feels like. A fun way to do this would be through Simon Says. So having a participant stand in front of a mirror, Simon says, touch your head. Simon says, sit up straight. Simon says, hold your reins like ice cream cones. So for hypotonia or low tone, before and after lesson activities, we'll focus on stability, that's core stability specifically, and muscle activation. So before the lesson, we're going to try and encourage our participants to wake up their muscles before they get on the horse. So we can encourage doing light massage, tapping or vibration on the thigh, tummy, and arm muscles that will be active and used during the lesson. We can encourage folks to wiggle their hands and feet and fingers and toes, trying to get the blood flowing. Again, doing a supported sit to stand, holding for 3 breaths and sitting back down. We're taking a supported walk. So taking 5 steps, a break, and 5 more steps. Of course, doing this with someone nearby or having the participant use their walker or mobility aid. We also want to encourage at-home activation of core muscles, especially in the belly and the back. So for example, having a participant sit as shown here on a seat or a block and really stabilize their seat first. So you can use pillows to prop, or maybe there's a back to that chair, and they can practice reaching for objects in the front, to the side, and behind. And as you'll see from this diagram, it really does activate several different groups of muscles that will be used during the riding lesson. Other things to do, if they can arrive early, doing that barrel practice, including stretching. And at the mounting block, again, being very vocal. So I'm feeling strong today. Maybe after all that warming up, this person is feeling really good. Also taking 3 deep breaths before mounting and taking another big breath and really sinking into the seat of the saddle to feel rooted. This is really important for folks with hypotonia because they really need that pelvic stability in order to perform gross motor tasks in a more successful manner. So after the lesson, I always love a good silly walk or sitting like a frog, just to take advantage of some of that loosening up of muscles we've created by virtue of being on the horse. At-home stretching may include a supported or sitting forward fold, sitting on a body pillow or bolster, and wide-legged child's pose, which is shown in this image here. These all look very similar to the ones for hypertonia, including progressive relaxation and a warm shower or bath. Okay, so we might be thinking, great, these are wonderful ideas, but how am I going to implement them and what exactly am I allowed to do? So I had a nice chat with Kirsten about some of these questions that might come up and some of the questions that I've heard from instructors. So, okay, so you've mentioned some great things we can do after, we can do before, but can path instructors really make recommendations for activities for participants to do? Like, are we allowed to assign homework? Well, the answer is yes. So what would that look like? It might look like handing them a handout or a piece of paper that's been photocopied where you're circling certain exercises or things that you'd want the participants to do at home. I think about and sympathize with busy parents who may not remember if you're giving them verbal instructions of what to do and may appreciate something that they could stick on the fridge and come back to when they have more time. So for example, one option, if there isn't something that we want to photocopy and give away, we could have flashcards or at least one printed option where parents could take photos of the things that apply to them. Similarly, at what point can a path instructor really request a reassessment or lesson observation with an OT? Let's say your participant, you have some questions, you're not really sure. Are they suitable? Are they not suitable? Are they getting more complex? Has their condition changed? The answer is anytime. You can reach out to Kirsten anytime and ask for her to sit in on a lesson and give you some advice. So some of the things that we talked about in the course of this webinar is, we're tapping, we're stimulating, we're moving clients. Can path instructors adjust limbs and use passive range of motion? So that's where you're moving the client's limb into a position. Or is it only really active range of motion that we're doing, where we're asking the clients to move their limbs themselves? So really, the answer is it kind of depends on the goal. So are we just moving a client's limb into a position to help them stretch? Well, we can do that as long as it's functional. So we're doing it so that they can sit more safely on a horse. And similarly, if you have any questions or you're feeling uncomfortable about, moving your client's limbs into a position, or you're not sure what you can do, talk to Kirsten because she can actually give you some advice and some training on what would work in your situation specifically. And if you have any questions or further concerns, please reach out to me or Kirsten. We'd be happy to discuss further with you. I hope you enjoyed this webinar on fluctuating tone and transforming tone with our clients.